with the task force meeting. I hope you guys are having an awesome summer. Happy Wednesday. And so we're going to get started with who is in the room, Or if you're new to our meeting, we would love to hear from you. What is your organization? What's your name? And what's your role? And what brings you to our meeting? So who's new to our meeting?
New. My name is Rainey. I work at PCC Wellness and I'm a peer doula. And so I work in the chemical dependency clinic and just other people in our department come. So I wanted to sit in when I can too. So.
Well, welcome, Rainey. All right, peer doula. That's an awesome job. I love it. Who else is new to the room? If you want to raise your hand, we can call on folks. Yes. All right. Assistant to Ovana Hernandez. Yes.
Hi, everyone. My name is Wamba, and I am Ms. Vana's executive assistant. I work at Phoenix Recovery Support Services with her. This is my first time at this meeting. I've come to some of your events. I even ran in the 5K and won last year. So I just wanted to just join the meeting and kind of get a better idea of exactly what you guys are working on.
All right, welcome. All right, who's next? I see Sierra.
Hi, my name is Sierra Stanton. I apologize for having my camera off. I'm traveling, but I am the Associate Director of Public Equity. We serve Greater Inglewood and Auburn Gresham. We are a community health organization and community violence intervention organization. And I was invited by Marvin Lindsay to attend because we are heading up a new program focusing on harm reduction.
Wonderful. Welcome to the meeting, Sierra. All right. I see Richard Green.
Hi, yes, my name is Richard Green. I'm a business development rep for Montrose Behavioral Hospital. And I came to the meeting.
Oh, that's you guys, that's the printer. Okay, cool. Sorry.
I came to the meeting to hear about what we have as far as resources for the community. And because sometimes we get patients that need those resources once they're discharged, and just to be able to educate myself on what's out there.
Wonderful. Welcome, Richard. Thank you. All right. Next, we have Dr. Mary. Dr. Mary.
Yes, thank you. Dr. Mary Roberson from the Northern Illinois Recovery Community Organization, better known as NERCO. We're located in Lake County in the city of Waukegan, and I'm here at the UIC Credit Union 1 Arena right now, and glad to be here for the first time to talk about what we're going to talk about. Thank you for having me.
All right, Dr. Mary, I look forward to your presentation, and you are such a ball of enthusiasm. I love it. All right, I see Brenda up here.
Yes, hi everyone. My name is Brenda Obana. I am a graduate assistant with COIP, the Community Outreach Intervention Projects here at UIC. I'm here today to learn more from you guys and also to hopefully have you guys help us on a project that we're going to be working on soon in persons that inject drugs. So yeah, I look forward to the meeting.
All right. Thank you, Brenda. A. Cofield from The Guardian, I think.
Sure. My name is Angelina Cofield, and I'm a manager with Volunteers of America for Veteran Support Services. Wonderful. So I'm here additionally just to learn and expand on my toolbox. Thank you for having me.
Right. Thank you, Angela, for coming. Appreciate it. All right. Leaf, a very cool name. I see you up here. Yeah.
Hi, hopefully you can hear me okay, but I'm the outreach prevention specialist at PHIMC. I am here today just to get to know other networks that do substance use work in the city.
All right, welcome. All right. I'm gonna say your name, but I always mispronounce it. So I'm Deanna.
Yeah.
That's right.
All right, Deanna, welcome, Deanna. Good seeing you at the meeting. Yeah.
Good to see you. I think it's my first time at this meeting. So my name's Deanna Zavoyska, and I work at Advocates for Human Potential. I'm a senior research associate. We work with the task force on a few things. So I'm just here to listen in, learn some more, and look forward to being here.
Glad you are here, Deanna. Appreciate it. Yes.
Thank
Jamila
you.
Hand. All right. Welcome to the meeting.
Hi there, everybody. Good afternoon. Jamelia Hand here, CEO of Vantage Clinical Consulting. I'm not new to this group. However, I've been doing some other things in and around our field for probably the last almost 4 years. So I'm really excited to be back in this space again. Definitely see some good friends on this call. And I look forward to being a resource of support in whatever ways possible.
Well,
Good to be
welcome.
here.
Good to have you here. Thank you.
Thank
All right,
you.
I see Karen.
Hello, everyone. My name is Karen Blaze, and I am with Emergent Biosolutions. I am Director of Community Health Solutions, and our company is a manufacturer of Narcan nasal spray. And so I am really here. My sole job is to really help support naloxone distribution efforts in communities and states and however I can. So I'm here to provide support in that aspect in any way that I can. Thank you for letting me join the call.
Thank you, Karen. I'm looking forward to our meeting on Friday. Yes. All right. Melina, right?
Yes, that's correct. Hello, everyone. My name is Melina Mazer. I'm the Development Director at Chicago Recovery Alliance. And I'm here today because I was personally invited by Lee. So I really felt like that I needed to attend. Thank you. Thank you for the invite.
You're welcome. Thank you for coming. Appreciate it. Sarah.
Hi, good afternoon, everybody. Sorry, I'll probably be off camera for a little bit. I'm home with a sick one, but I'm not new to this group. It's just been probably about a year since I've been able to join due to some scheduling conflicts, but I'm from Cook County Health. I support all of our recovery support services throughout our health system. So really excited to be here and connect.
All right. Thank you, Sarah. Wonderful. Claudia.
Hi, good afternoon. My name is Claudia Marquez. I am the Behavioral Health Community Liaison at Sinai Chicago, which includes Mount Sinai Hospital as well as Holy Cross Hospital. I've been with Sinai for about 2.5 years, but I'm new to this role. You guys may be familiar with Marcos. He's no longer with Sinai. I'm replacing Marcos as the Behavioral Health Community Liaison. And I was actually invited by Ingrid, program manager for our opioid medication-assisted treatment referral program here at Sinai. She suggested I attend these meetings, and I'm very interested in learning more about all the resources.
Thank you. Thank you. I thought I saw Dr. Blackwell. Is he in the room?
Hey, yeah, I'm here, but I'm like in and out because my new manager, she has to go to another meeting. And then you guys got to send me the email. That's why you got to send me an invite. And I mean with partners, so I'll be in and out, but I'll definitely be listening. Like I said, Bobby E. Wright is here. We are committed to the behavioral health of the West Side of Chicago. Please drop you guys' emails in the chat for me because I want to meet with everybody as we progress forward to make sure that we address the needs on the West Side.
All right. Dr. Blackwell is the new CEO. Is it CEO
COO.
or COO? CEO of Bobby Wright. So
Yeah, Chief Ops Officer.
They're back. All right. Anybody else? Did I miss anybody? New to the room?
Hi.
All right. Yes.
Hi, my name is Barbara, and thank you for inviting me to the meeting. I am a resident of Austin, and I'm also I'm a behavioral health nurse, as well as I work with folks that have substance use disorders. I have a personal and a professional interest in joining this task force. I'm also a student at Loyola, a doctoral nurse practitioner student. So I want to learn more about harm reduction and how to support our community. So thank you again.
Thank you. Welcome. Welcome. Do not forget to put your name and your organization and your role and your contact information in the chat. I think I we called on everybody who's new. So thank you. Thank you for coming and welcome to the meeting. We're going to get started with our very first presentation from Dr. Jenny. We're excited about what's happening on the West Side, and Dr. Jenny is going to tell you about all the good stuff that's going to be happening. All right.
Thanks, Vanya. Thanks so much for giving us time to chat a little bit about overdose trends that we've been seeing, the summer activities that we have been planning. Really, you know, not possible without the dedicated engagement of the West Side Heroin Opioid Task Force, as well as all of you all who have been assembled here. So for those of you who don't know me, I'm Jenny Huang, Medical Director for Behavioral Health at Chicago Department of Public Health. We have been establishing a incident command structure since the beginning of June in order to respond to the seasonal spike to opioid overdoses that we see every summer. So this is just some data that we compile on a week-to-week basis. As you can see, over the past week and weekend, we actually did see a little spike in opioid-related overdose EMS responses. So citywide, that was up 176 from the previous week of 161. West Side, you saw a more significant jump proportionately from 55 to 76. Citywide hotspot, the hottest of the hotspot remains on the West Side in the area around Madison, Washington, and Keeler, and the Pulaski corridor near 290. Our ED admissions data similarly shows a spike between June 20th and the 21st. So kind of 21st, 22nd, Friday, Saturday of this past weekend, we did see a jump in the number of ED admissions for opioid-related overdoses as well. So switching gears very quickly now to all of the sort of high-level overview of the activities that are going on. I won't sort of belabor the detail because I know many of you are in other meeting spaces with us, in which I'm probably sound like a broken record to you at this point. But the one upcoming program that I want to highlight in this group in particular is we have an upcoming door-to-door canvassing campaign that we're calling Operation SOS, Summer Overdose Safety, with West Side Heroin Opioid Task Force, in which we will be providing Narcan harm reduction education to every household in the priority blocks, which are blocks in the 5 West Side community areas that have experienced 1 or more opioid-related EMS responses in 2023. We will be building and distributing leave behind bags that contain Narcan, first and foremost, as well as information in harm reduction and treatment-related resources. And our goal here is really to organize you all to help educate the community and disseminate the information that you have been providing as widely as possible through this avenue of door-to-door outreach. We are hoping that this will begin next month, but you know, as you are probably familiar, city processes can take some time to finalize. So that being said, that being said, I'll come back to some of the action planning that I'm hoping we can spend some time in this next 20 to 30 minutes to build out. I also want to highlight that we have been outreaching to some of the hospitals on the West Side and the South Side that are historically seeing a large number of overdose ED transports, and trying to disseminate the idea that buprenorphine in particular is useful not just for treatment, but for harm reduction. Some of you may know of this as Suboxone or Subutex as a treatment medication, but really it, you know, from my perspective, from many of our perspectives, it's not just that you have to be on it and then not go back to using substances, but rather buprenorphine itself has a chemical efficacy for preventing a second overdose as long as it's in the body, right? It can also be useful for withdrawal management. So even if you just take it for 3 days a week, 1 day, for as long as it's in the individual, it is protecting them potentially against a second overdose from fentanyl or other of the highly potent opioids that are increasingly seen in our drug supply. So some of that outreach work, of course, begins with medical providers and hospitals. We know that there are also many hospitals interested in working in developing protocols around drug checking. Hospitals oftentimes obtain drug samples from the patients that they treat. And these drug samples, unfortunately, are oftentimes just confiscated and thrown out, right? Is there a way where we can link samples obtained through this avenue to drug checking organizations that can provide us information on what is sending patients into crisis mode to begin with. So these are all sort of ongoing outreach efforts, and I kind of see the community-based efforts and the hospital-based efforts as the two main prongs of our department's summer opioid overdose strategy. So that being said, I do want to highlight some next steps that I want to bring to everybody's attention. So, you know, we're waiting for the city's red tape to kind of shake out in terms of when our first knock will be. I'm hoping it's going to be mid-July, but we all know that 4th of July is around the corner. Overdoses tends to historically spike over 4th of July weekend. It's a celebratory time, but it's also a time when there might be an increase in drug use. So, you know, I'm hoping that we can all share our outreach plan for that first week. When or where will your organization be? And in particular, we are working with the press office to set up media engagement and potentially getting some press coverage for the outreach activities that will be going on. We're targeting July 2nd as a day when we might have some cameras on the ground. And then maybe again, we're trying to also get some press coverage for our door knocking campaign. So those are two opportunities for you know, getting in front of the cameras and talking about both the overdose epidemic, but you know, people hear about it maybe a little bit too often without also learning about everything that we've been doing to address it. So it's a great opportunity to put the work that your organization is doing front and center. So I guess I'll stop talking, and I really just want there to be a robust discussion about our plans really for next week. Yeah. Hand it over.
All right, thank you, Dr. Jenny. Anybody have any comments? For Dr. Jenny?
I see a couple comments from Chelsea. Count Illinois Harm Reduction Recovery Coalition in to help with outreach, including members and interns. And Leaf said a PHIMC is able to do material educational production if that's needed.
Lovely. Very good.
Thank you for that input.
Mm-hmm. Questions, comments, thoughts, ideas?
I have one. Good afternoon, everyone. This is Jamelia. Dr. Jenny, I owe you an email, first and foremost. Secondly, is there anything published or that this group would have access to regarding the summer events planned through the city and whether or not you'll have a presence there in overdose reduction?
Oh, do you mean festivals, concerts, events of that sort?
Yes.
Yes. Okay. So we have been working, that's, you know, a body of work that I decided that I wouldn't really delve into in the interest of time, but we have been engaging with DCASE and, you know, I've been talking with some of these festivals. So those of you may be aware that there was a statute that went into effect in which stating that music venues with capacity 1,000 or more need to have Narcan on site and staff trained in harm reduction. I think many of these large festivals are complying with that. state statute by involving EMS, emergency medical workers on site. That said, we have also offered our services, right? We partner with Miles Square and are happy to partner with other organizations. I think Access has also expressed a willingness to partner with us to go out to these festivals to the extent that they are happy to accommodate. And we have some coming up, and we're waiting to hear back from some of the big ones. So if you're interested, feel free to reach out to us. I'll put my email, or actually, I don't know if Dora, our operations chief, is on the call, but
yeah, I'm typing my email right now.
thank you. And if you want to be a part of that, you know, I think like there's a lot of interest, but we need to make sure that the demand is there right now too.
Got it. Thank you, Dr. Jenny. Could you also put a link to the statute in the chat if you're able?
Yes, I'll put it in there.
Oh, thank you.
All right, thank you, Dora. I see Katie has her hand up.
Hi, thank you. Sorry for the unprofessional floor sitting. My cat's being nuts and needed me to be with him at the same time that I'm in this. I'm Katie Prout, Chicago Reader. I come to these meetings occasionally and write about harm reduction and overdose prevention and homelessness in the city. I had a question about the door knocking. You mentioned that there'd be Narcan and like harm reduction materials or like information. I was curious if there was other materials beyond Narcan, like test strips or safer use supplies that were going to be included. Yeah,
that's a great question. We are thinking of some of the basic supplies that the city will provide, right? It's going to go in a tote bag that we will be providing, and of course we can provide Narcan and educational material that we have developed over the years regarding signs and symptoms of an overdose, how to utilize Narcan. We do have fentanyl and xylazine test kits. While the aims of this outreach effort is to be relatively broad. So I think when we're distributing some of those test kits, just because of how onerous it is to assemble them in terms of like a staff time, we want to prioritize who gets those equipment. But that's certainly something that we are considering, you know, how to disseminate those in a more targeted fashion than potentially some of the other materials that sort of serves as the baseline set of items in our packing list.
great, thank you.
Any other questions? Yes.
John Werning asked if this is on July 4th.
Well, so there's a couple of different things, John. So July 4th is a holiday, as a city holiday. So so there's first of all the press coverage that we are aiming, not guaranteeing anything, but aiming to pitch something to NBC for coverage for July 2nd. You know, a few days ahead of the holiday, just to kind of, I'm assuming that there will be usual, if not higher than usual level of outreach activities on the West Side. So I think if we can assemble all you all assembled here to sort of commit to a higher than usual level of outreach activities, and that certainly serves as a story that we can pitch to get news media coverage on July 2nd. That is the pitch that we are working towards. So if you would like to put your organization's contact information, location, time and location of availability for July 2nd, then we can incorporate that into our pitch and see if we can get news coverage for the activities that you have planned. Separately, we have the door-to-door canvassing that will likely happen later on in July. It won't be coincident with the first week. And that will also entail some amount of coverage, we hope, but that's not something that, you know, we have the bandwidth, frankly, to be concretely planning for right now. So it's really just for July 2nd. If you or your organization have plans to be doing harm reduction outreach activities on the West Side, time and location put that in the chat, that'd be great.
Okay, Chelsea, followed up with anything we could share with our networks about logistics and who to reach out to for involvement with state. Michael Banghart basically said the Renaissance Austin Engagement Center will be open with access to our harm reduction vending machine. Did you want to give us the address on that, Michael? Since for people who might not know. All right.
All right, thank
Let
you.
me
There he
get
is. There he is.
Sorry, my speaker wouldn't come on. I don't remember that off the top of my head.
It's Chicago and Cicero, roughly, right?
Yeah, Chicago is just west of Cicero and Chicago.
You can't miss it. It's the big pink building, pink on the outside, lovely
Mural.
lovely mural out there. Yes.
Great.
All
And I think, and Karen said, please reach out if you would like to have educational resources, materials related to Narcan. This is from Emergent Biosolutions, makers of Narcan. Okay, and Jamelia, come in.
Lovely.
CRA will have its Humboldt Park site. I know you probably all can read this, but just in case. From 5 p.m. to 7 p.m. On what date is that, John? What day?
That's on the 2nd, that Tuesday.
Okay, thank you. 4853 West Chicago. And then Jenny put her information in the chat. I think we're up to date.
All right. I want to encourage you to reach out to Dora and Jenny regarding where you're going to be on July 2nd. Like I said, we need a media coverage. We need to raise awareness that the drug supply is toxic and that people who use drugs need Narcan and safe supplies, right? So please, please let Dr. Jenny know, let Dora know so that we can spread the word and also spread as much harm reduction materials on the West Side as possible. All right. Thank you very much, Dr. Jenny. I appreciate that presentation. Next, we have Brenda, who is going to talk about a survey that she needs to do with people who use drugs and HIV. Brenda.
Yes, thank you. So like I said, I am a graduate assistant with COIP. This year with the National HIV Behavioral Surveillance Survey, we are targeting persons who inject drugs. So our goal is to recruit 500 participants from now until November. They will be compensated $40 for the interview and $40 if they agree to undergo HIV testing. They will also be compensated for recruiting other participants within their network. So our idea is to use respondent-based respondent-dependent sampling to carry out these surveys. So initially, we would like to start with young, what we call seeds. And these are individuals that are representative of the population, and they will have a large network, a large social network, which they will be recruiting to come into the survey. So our idea to use young seeds is because we see that there is a lack of young participants, of people who inject drugs in surveys. So we want to start with those participants, and then we know that eventually it will reach the greater population and hopefully be representative of the entire population of persons who inject drugs. So my request or COIP's request is if you all know a possible participant that is a individual who injects drugs and is under the age of 30, if you could reach out to me or if you could reach out to Dr. Antonio Jimenez, so that we might be able to use a young seed as the initial participant in this sample. So yeah, that is my entire presentation. If you guys have any input, I would welcome it.
Yeah, there's a couple statements about that. Leaf said that she could see at their next meeting if there's organizations to work with youth to participate in sending out surveys. And then Carolyn Bloom said, what do you consider as young?
So we're looking for someone who is under the age of 30 with a wide social network. And when I am referring to a wide social network, is a social network of other individuals who also inject drugs. Perfect. I will type in my email.
And folks, what we do is, if you haven't been here before, we do send out this chat. We take all the private chatting out, so don't worry. Privately chat away. I think John and I learned that a long time ago. But anyway, and I also want to mention Dr. Napier at Rush mentioned that there's a Narcan newsstand, one of the 20 that were part of the what was the name of the group? I'm sorry. Anyway, that we got out on the community, and then there's one at Mount Sinai, and Claudia is keeping track of all that going on over there. You know, the folks who gave us that aren't in the room, so I can.
You're okay.
But I know I'm going to be sending something out to all of you that have them, because we haven't checked in with you, but they've been a real boon to the community. I know Dora Wright has been saying how great it is, and I know that one over there in the ER is really used a lot. So anyway, back to you.
Anybody have any more questions for Brenda? All right. Thank you, Brenda. Appreciate you and all the work that you're doing. All right. So the next person up on the schedule is myself. We are having, once again, an Overdose Awareness Day resource fair on Friday, August the 30th. We finally secured a location. It is going to be next to Catholic Charities Augusta Token Peace Center. And so it's that parking lot we're going to be in off of Corcoran and Central, in that area. And it is going to be a great event. I am looking forward to it. It is actually our 5th one. So we're having an anniversary. It's our 5th one. So I'm calling out because I need drum circles. If somebody has a drum circle, I would love to get some drum circles. I would love to get some yoga going on because there's a little peace garden in that area. We need you all to register. So I'm going to drop the flyer in the chat because we're going to get t-shirts for everybody. I need to know the sizes. We're going to have some fun, some music. It is going to be a blast. We're going to tell the neighborhood about your resources and what the work that you do is so important. And so once again, I'll put the information in the chat to register, and I need all your t-shirt sizes and your logos. And if you have problems with the QR code, let me know. We'll figure it out. We need to get everybody's information out there. So it's going to be a great time on August the 30th, Friday morning from 11 to 1. And that's it. That's all we do. And then you can head over to your other celebrations for International Overdose Awareness Day. And the theme is Together We Can. All right. All right. Our next announcement, which I am so excited about, is the fact that Chicago, for the first time in its history, will be hosting the National Rally for Recovery. So I am going to turn this over to Dora Wright, Dr. Mary, John Wright, who are all on the call, to tell you about this exciting event happening in September.
This is Jonathan.
Hey, Jonathan.
Hello,
Mike
everyone.
Deschamps, IDHS Super. How are you?
Hey, I'm doing wonderful. How are you, Mike?
Okay, hello everybody.
All right.
Hello everyone and welcome. I want to introduce to you and talk about the National Rally and needing all of you to support and be a part of it. For the first time, our parent organization, Faces and Voices of Recovery, Illinois has been selected to host the National Rally for Recovery. Chicago Recovery Communities Coalition and the NERCO Illinois Recovery Community Organization are co-hosting this National Rally for Recovery. It is being held September 21st, 2024 at the University of Illinois Chicago Credit Union 1 Arena. And we want you with us. We invite you to contribute to this amazing event. There's going to be educational workshops, food vendors, celebrity, national speakers, advocates, and we have different levels of recovery sponsorships. And the Westside Opioid Task Force is our friend and advocate in this. And we are just excited to be able to host this event. It's family friendly, and we need all of you to contribute to this event. I'm going to turn it over to Dr. Mary and John if they have anything to add, because we have 5 to 10 minutes to tell you about this wonderful event.
Okay, I'll jump in. As Doris said, we are co-hosting the national rally. Your friends in the Northern Illinois Recovery Community Organization, better known as NERCO. We are over the top with excitement because this is going to be super. We are looking at multiple pathways, our harms reduction community, everybody that's all involved in what we're doing here in the state of Illinois for those that's impacted by substance use disorder, opiate use disorder, people who use drugs, the whole 9 yards. You know, be there or be square. It's going to be awesome. We just did another walkthrough through the UIC Credit Union 1 Arena. It's going to be super, and we just hope that you could be a part of it. I don't know if Spania have the information on the tiers, the sponsorship levels, vendors, if you want to boot and all of that stuff, that information, if you don't have it already, it'll be sent out to you, and we're open for any questions that you may have. Hey, this is phenomenal for Illinois. The SUPRA, Illinois Department of Human Services. I'm not Human Service. Yeah, Human Services is going to be painting the skyline purple. The governor is working on a proclamation to make that day National Recovery Day, and as well as, if you don't know already, you might know that Earth, Wind, and Fire has a song called Do You Remember the 21st Day of September? So we're going to be rocking that song so that you could be dancing off of Do You Remember the 21st Day of September, when the National Recovery Rally was held right here in Chicago, Illinois, the hometown of Earth, Wind, and Fire. Yeah, so be there or be square.
This national rally, you all can take CRCC and NERCO, you all can take us out of this. We are just sands, pebbles on the beach. This is about bringing recovery alive in Illinois. This is your opportunity to come out and be a part of this first time ever national event that's never been held in Chicago nor Illinois. So this is your opportunity to come out and show that we can stick together and do this thing, this recovery thing in Illinois. Thank you all.
All right. Does anybody have any questions?
There was, Leaf wants to know how to get involved in the event. Is there some information we can put in the chat, or is it already in there? Or we'll definitely send this out in our recap as well.
I'll add it in the chat right now.
Okay, thanks. A lot of people digging it, as we all should, or why not? This is great.
Dr. Mary, I was kind of excited. You were talking about Earth, Wind, and Fire. I was like, are they coming?
No, they won't be there, but the music will be there. So you can bump to that 21st day of September, the reason why we here, and all of that stuff. Let me see the number of Earth, Wind, and Fire fans on there. Wave your hand like you just don't care. Uh-oh, we got 2 of them. Thank you.
All right, do we have any more questions? All right, so we didn't have any work group announcements today because our work groups are still working. So we decided we wanted to hear what you guys are doing for the summer. Put your information and events in the chat, but this is your opportunity to share what's going on in the summer so that we can participate and support each other in each other's activities. So raise your hand. Let me call on you. Tell us what you're doing for the summer. But we're not doing anything. John, yes.
Hey, everybody, just, I know there's a little bit of time left before IOAD, but, you know, it's gonna go by real fast, as we all know. CRA has a barbecue every year. We actually have 2 barbecues, one on our west side and one of our south side warehouse sites. The west side one is always on International Overdose Awareness Day, which this year is the 31st, which is a Saturday. So please, if you're available, we always have a barbecue, and some of our community partners come out and just provide stuff for the community. It's just one of those days where we try to give back to the community as much as possible. Ends up being a really fun time. And then our south side one will be a little bit before that, I think, this year. Of course, I believe it's the end of September, CRA will be participating in the AIDS Run Walk, and we would love everyone to join us if you are feeling like you can run. I believe it's a 5K. I don't know if it's an actual 5K, but if you'd like to support our team or run alongside us, please do so.
All right. Thank you, John. Those sound amazing. Yes. All right. Public equity.
Hey, good afternoon, everybody. My name is Tony Woods. I have my Associate Director, Sierra, stand on the call as well. We are a public health organization based on the South Side. Our primary focus is violence prevention. We have quite a few events we'll be doing this summer. I think the biggest one, we'll be hosting a public health fair for community members in the greater Inglewood community. This will be it kind of be like a hybrid back to school event. So we'll have like mobile health units out there where kids could get free shots and vaccinations and everything they need to go back to school. I'll actually send out the flyer to the host of this meeting. And just to give you all some context, this again is our first time attending this meeting, and we were invited by Marvin Lynch. So just glad to be here.
All right. Thank you for coming. Love Marvin Lindsay. All right. And please put your information in the chat so people can reach out and connect with you all. I love the name Public Equity. Yes. All right.
Absolutely. Thank you.
Yes. Michael, tell us what's happening at Renaissance.
Oh, so much going on. We're excited that July 1st, we're starting a new health outreach team for the West Side and the Southwest Side. Yeah, so we're hiring street medics to work with our street outreach team, serving people who are homeless and on the streets, and working to bring those health services to people who are unhoused.
Yes, let us know how we can connect with you. We would love to be trained with you guys and to support your work. So thank you, Michael. That's amazing. Yes.
Thank you.
Anybody else? Summer activities, things that we should be aware of. Put your information in the chat, please, so that we can capture all your contact information so we can send all the information out to you. Lee.
No, I got nothing to say.
Well, it looks like, oh, Michael? Yeah. It looks like our meeting is over for today. I'm going to give you back some time. I want to emphasize, though, for the West Side, before major holidays, there are issues with, I think, the drug supply with the new drug out, the new adulterant that's causing people to be knocked out. We've heard it was called great death, as well as what was another term used for it. I encourage all of you, if you do not have to be in the office on July 1st, 2nd, and 3rd, you don't have to sit at the computer, you don't have to look at it because everybody's out of town, they're going to meetings, but you are the lone office worker, right? Come on out with the Westside Heroin Opioid Task Force. We will put out our calendar and you can come on out, work with us, shadow us to do street outreach with our team July 1st, 2nd, and 3rd. We need to saturate the West Side with Narcan and with harm reduction materials. We need to make sure that people who use drugs know where to go to, how to stay safe. And so it's very important to just get out the office, just enjoy the weather and come work with us. It's just so important. We don't want to see the spike that happened over Mother's Day weekend. All right, Public Equity, have a question? Or your hand up from something before?
Oh, no, sorry about that.
Okay.
I think I'm just still up, yeah.
All right, so we will be putting out our schedule in a couple of days for July 2nd and July 3rd and 4th. Dr. Jenny is going to tell us where we need to meet for the press coverage or press conference on July 2nd. So please look out for emails from the Chicago Department of Public Health, Office of Substance Use, because we want everybody there to make sure that people are aware that we, as the Westside Heroin Opioid Task Force, all the members of the Westside Heroin Opioid Task Force, we care for the city, we care for people who use drugs, and we want them to stay safe for the 4th of July weekend and beyond. All right. Thank you once again. Have a wonderful afternoon. Bye-bye.
Thank you, Fanya.
You're welcome, Mary. Thank you.
Thank you, Lee.
Yeah,
Have a good afternoon,
you're welcome.
everyone.
Great to
Take
see
care.
everybody.
Thank
Great
you.
to see everybody.
See ya.
We'll get this out to you all. Hey, Cherie. Cherie.
Bye, guys.
Hey, sorry, I'm on my phone. I'm over here.
That's all right. Nice to see your smiling face.
Yeah, thanks for putting me
Quick
on.
question,
giving me
are
setting
Hey,
up
the
V.
the info.
notes that are
What's
being
that?
recorded going to be emailed? The notes that were being recorded?
Yeah, the recording and the chat will get out at, I don't know, probably in the next couple of days, right?
Okay, all right, thank you.
Yeah.
You're welcome. Welcome to the meeting. Yes.
Thank you.
Hey, V.
Thank you,
Hey,
Fanya.
Mary. Always
Thank
nice to
you,
see you.
Mary. You
Hey,
too, you
Jackie.
too.
All right.
All right.
Later.
All
Later,
right.
Miss.
I'm
See
going to
you.
end the meeting for everybody. Have a
All
good day.
right.